this is Bill Adams. You're watching Senior Focus on Channel 20 and 100 on Armstrong Cable. Senior Focus is a show designed for folks over the age of about 50 or so. Today we're going to be talking, though, about something that applies to people actually between the age of, say, 18 all the way up to 65. And it's something that's kind of near and dear to my heart because it's called Access Health Mahoning Valley. And I'm the director, and we will describe what that is. But we're coming to you to talk about enrolling in health insurance. And again, it goes all the way up to age 65. Of course, if you're over 65, there's Medicare, and we could talk a little bit about who you might want to talk with if you have questions about Medicare. We want to thank Greg Roden from Armstrong's Channel 20 and Keith Kaiser from the Mill Creek Metro Parks. We come to you from the Davis Visitor Center, and of course, it's a great time to visit the center. Right now they have an orchid exhibit upstairs, but the parks are wonderful, and we would encourage you to come out and support the Metro Parks. So I have today with me fellow staff members from Access Health, and I'll name them, I guess, let's start from left to right, and Charlene Allen is on the far left. Charlene is our Trumbull County Navigator. In the middle, sort of, is Elena Birch. She is with Mahoning County and also Ashtabula County as a navigator, and we'll describe what that is. And then next to Elena and next to me is Maureen Zamorelli, and she is a care coordinator, and we'll talk with her a little bit later about what she does with Access Health. So the reason we're coming to you at this time of the year is there's an important deadline of February 15th coming up, and maybe I could start with Charlene if that's okay. And Charlene, you could describe what the deadline is and what's coming up with health insurance enrollment.
Okay, yes. On February 15th, it is the deadline for anyone who needs health care coverage to sign up on the marketplace. And that's the website, which is our healthcare.gov website. You have until midnight on the 15th to get enrolled. If you miss that enrollment, you can't sign up again until November of 2015. If you are Medicaid eligible, you don't have a deadline. You can sign up at any time.
Yeah, and that's important that people realize that again, you'll hear a lot about the deadline. That's for people that are above Medicaid. But if you're unsure, you certainly want to get either on the website or you want to talk to one of our staff before the 15th to find out. Now, Elena, would you describe where you're located or where our office is in Youngstown?
Our offices in Youngstown are located in the old Southside Hospital. It's 345 Oak Hill Avenue, Youngstown, Ohio. We are in the same building as the Health Department and Jobs and Family Services on the second floor.
Okay, and we asked people to reach us at our main office, which is up in Warren. We're with the Warren Health Department also. That number is 330-373-0703, and we'll mention that a few times during the course of today, during the show. Again, with either Charlene or Elena or both of you, would you talk about some of the places you're going to try? Not only do we have our two offices, but you guys do outreach, and maybe some of the places you go.
Yes. The goal of our outreach program is to reach as many of the residents in Trumbull and Mahoning County. And currently, one of our outreach places is at the St. Joe's Hospital facility that is located within the Eastwood Mall. It is down in the Sears Concourse. I also do outreach at the St. Joe's Hospital and the St. Joe's Clinic there in Warren. And we're having several outreach events over the weekend leading up to the deadline on February the 15th, and they can just call the office to get those particular locations.
And then for Mahoning County, well, we should mention that there's one other staff person who's not with us because she's out in the field right now, and that would be Elaine Smith. But Elaine is at, and correct me if I'm wrong, she goes to the
Salem Library.
Salem Library down in Salem. She also goes to East Liverpool. But in Mahoning County, there's the St. Elizabeth Healthcare Family Clinic, which is right across from the St. Elizabeth Hospital. And again, Elena, you're over at our Youngstown office at the Youngstown Health Department. I want to thank both the Youngstown and the Warren Health Department, and without them, we would have no office. They provide a rent-free space for us at Access Health. So again, you would contact us, if you want to set up an appointment. Why don't we talk about, I think, Charlene, you mentioned healthcare.gov. Mm-hmm. It's www.healthcare.gov. What happens when you start, say somebody comes in to talk with you, what are some of the questions you have to ask?
Well, some of the questions that they usually ask, because everything is really based upon your income and your family side. So most of the questions is going to pertain to those two areas. And then the individuals, after they go through that process, then they have the opportunity to select a health plan. And two of the important things that I tell the clients to be sure of, number one, that they can afford the premium, and number two, that it has their doctors and their hospitals in the plan that they select.
Mm-hmm. And Elena, could you describe the, and we're going to show, I think on the online here, not online, but on the show, like a snapshot of what the website looks like. But if you go to www.healthcare.gov, there's you can compare plans. Is that right? Mm-hmm. And you want to describe what you enter, actually the information you enter?
Yes, the information that you enter when you actually go onto the website is actually going to be your household size, your expected income for 2015, your age, and also if you are a tobacco user. Then based on that information, they provide plans through the marketplace where you can go in, look at, and select and enroll if you choose to. They offer plans through 9 different insurance companies, and that's it.
Yeah. One of the things that's good to remember, and it has been a while since this law passed. This is the Affordable Care Act, and it's been about 5 years since it passed. In the old days, if you remember, when you signed up for health insurance, they would ask you all kind of questions. Mm-hmm. What's your health history? When were you in the hospital? It would take you, maybe an hour to fill out all these things about your health history. Right now, though, one of the good things about this is they've done away with all of that. And Elena, as you were mentioning, it's just basically your age, your zip code, and whether you were a tobacco user. That's the only real health issue they ask about is tobacco use. So that's the only thing that affects the premium. For people who are worried about the cost, again, either Charlene or Elena or both of you, could you talk about how has this law affected the affordability? How are people now maybe able to afford coverage?
Well, I have not done anyone who has not been able to get a premium tax credit. And what that means is the federal government will provide you X amount of dollars to help you to pay for that premium. And then there's also such things as it's not a co-insurance. What's the word I'm thinking of? Yeah, a cost-sharing reduction. So everybody basically is getting some type of a financial help in paying their premiums. And in the event that a person just absolutely cannot afford a premium, then they can file an appeal and ask, for some type of a consideration if they just cannot afford the premium at all.
Yeah, and we're talking, I think, up to 400% of the federal poverty level will qualify for some kind of premium tax credit, mm-hmm. which, is a, pretty good amount of money that you could continue to earn and yet get some help. And I think, I was reading recently that the average across the nation, the average premium tax credit is about $250 a month. Mm-hmm. So have you found folks that, basically that reduces it to a real low amount, what they have to pay? I mean, what are some of the amounts that you're seeing for premiums, just in general?
Well, there again, depending upon the family size and the income, I've had someone as low as $48 a month in their premium to a high of $221.
Okay. So that's, but still, that's a lot better than maybe $500 or $600 or $700 that they might have to pay.
Exactly.
Yeah. So when they look at the website. There are different types of plans, and again, maybe I don't know, Elena, if you want to describe the different. It's based on cost, but we want to talk about different types of plans.
Yes, there are 4 different types of plans that are offered through the marketplace. There's bronze plans, silver plans, gold plans, and platinum plans. Most people steer toward the silvers. Those are the ones that have the most tax credits to offer. But there are 4 different plans through the marketplace, and you're free to choose whichever one is affordable for you.
Yeah, and you both mentioned, I think, the cost sharing reduction. Now, that's something that I think a lot of people maybe want to know about, and that's only available on silver plans, correct?
That's
Yeah.
right.
So just for instance, you could have a bronze plan that may be cheaper because it's the lowest cost plan. But, and so, just for instance, you may save $50 a month or about $600 a year, but the deductible and the copays could be several $1,000s more. So if you're using your coverage, you might want to look at that. Is that something, again, that you guys steer, not steer people to a particular plan, but let people know about?
Yeah, absolutely. I really encourage people to avoid the bronze plan if they can, because I point out to them that they have to meet that deductible. And sometimes it could be $3,750 or it could be up to $6,000, which means that they have to pay that amount of money before the insurance would ever kick in. And most people cannot afford to pay that kind of money out of pocket.
Again, we're talking about marketplace plans, and that's for people above Medicaid. And maybe at this point we could mention, the approximate amounts we're talking about. I just, I happen to have the list here, but for a one-person household, yeah, if you're by yourself, if you make $16,104 or less, and it may be slightly, off of that because we're going into 2015, but in the area of $16,000 or less, you probably qualify for Medicaid. But if you're above that, then you're going to be doing the marketplace. If you're a 2-person household, it's about $21,700. So again, if you're below that, you'd be talking about Medicaid. And if either one of you want to talk about, how does the Medicaid process work? What do you need to do for that? Is that something different?
Well, the Medicaid process is actually a little bit more streamlined than the marketplace process. And there again, it takes about 10 minutes, providing that the computer is working the way that it should. And it asks the same types of questions in terms of income and your family size. And then it takes approximately 30 days after the application is submitted to the local Jobs and Family Services. It takes approximately 30 days for a family to get a determination.
And so that goes in Mahoning County. Elena, where does that go then, the application?
The application goes to Jobs and Family Services for Mahoning County, and also through Medicaid. They want to know what your monthly income is when you fill out the application for Medicaid. Slightly different for the marketplace. They want to know what your expected income is for 2015, whereas Medicaid, they want to know what your monthly income is. So basically, once you submit the application online, it goes down to Jobs and Family Services based on your county. They have 30-day processing period to approve or deny your application by law.
So, just looking at the Medicaid numbers, again, that would be a little bit over $1,300 a month, I think, is for a one-person household would be the limit. What you were talking about, it was something interesting, going back to the marketplace. I know they're looking and they're asking for the expected income for 2015. And sometimes that's a little tricky because people lose jobs or they gain, employment or things change. What do you recommend people bring in terms of, proving income? Are there some things they ought to maybe bring with them to an appointment?
Yes, you can bring, for the marketplace, you can bring in your W-2s. They'll accept those to enter in your information because it's hard to determine actually what your expected income is going to be. So basically, if you have your W-2s, we can go off of that. But one important thing you must remember with the marketplace, if you decide to enroll, is you have to report any changes in your household. Whether it be you lost a job, or either you were working a certain amount of hours and then your hours got cut, or either you were working a certain amount of hours and then you get more hours, then you have to report that, because it's vitally important to report changes through the marketplace.
And I was just going to say, Charlene, that's because when this is all tax related, right? Again, we're
That's
talking
right.
about the premium tax credit. So you want to describe what would happen, say, if I signed up this year and then I lost a job, I'd have less income, so I should get, what, more of a tax credit?
Yes, and the other thing is, you may end up owing if you have already gotten too much of a premium tax credit. Then at the end of the year, when you file your income taxes, then you may be in for a surprise that you may owe money as opposed to getting money back. And the other types of changes that people should report is if there's a death, if there's a divorce, if they've had a child. So it's just real important to always to check back at the beginning of the next open enrollment period to make sure that you're getting the amount of tax credit that you're entitled to.
Well, and speaking of contacting the marketplace, I know there's an 800 number. I have it here, and it's 1-800-318-2596. And again, our navigators, that's a job title at Access Health Mahoning Valley. They can help you with that, refer you to that number. Again, our number is 330-373-0703. Are there any, again, without obviously naming somebody's name or anything like that, but are there some situations or people that you've worked with that stand out, that they've had a good experience and they were, satisfied with the help they got through the Affordable Care Act?
Yes, I just did a client the other day. She was paying over $300 and some out of pocket for her health care coverage. And after she went on the marketplace, it went down to $182 and some change. So needless to say, that made her very happy that she was able to save money on her health care coverage.
Yeah, that's over $1,000 a year, almost
That's right.
$1,500, yeah. And in fact, I remember last year, we've been doing this for 2 years now. This is the second year of the grant. But last year, Charlene, you worked with, and again, I'm thinking of the people, that may be watching the show that are between 50 and 65. You worked quite a bit with some people who lost, it was the steel workers, I thought, that lost some benefits. So we do get quite a few people between the ages of 50 and 65, I think, right? They're not quite Medicare eligible.
Right.
Yeah. Have you both had that, or have you worked with some folks that are over 50?
Yeah.
Yeah. Speaking of which, if you're over 64, say you're 65 years old, these folks wouldn't be on the marketplace or this plan, correct?
That's right. That's right. Those folks would be entitled to be on Medicare. And if somebody has the Medicare coverage, then legally, we're not even allowed to assist them with enrolling in a health plan.
One thing, though, we've had, I think it was Debbie Sharilla, she's from the Senior Center in Youngstown. If you have questions about Medicare, she's a social worker at the Senior Center, and she is a volunteer through the Ohio Senior Health Information Program. I think I got it all. But anyway, you can contact Debbie at the Senior Center if you're 65 plus and you have questions about health insurance. Again, we're working with people between 18 and 64. So, with the plans, I think, Elena, you mentioned 8 or 9 companies. How many different choices would somebody have between those companies? Just a ballpark.
There's many choices that you would have. I'm seeing up to sometimes 20 different plans for one person to choose from, probably more in different circumstances. So there are many choices to choose from.
So you go on the healthcare.gov, www.healthcare.gov, and we're going to enter in, a zip code, and then your age.
And their approximate income.
And that'll give you, now these are estimates.
Right.
So, you got to, go through the application to get the actual cost. But the estimates, again, obviously with health insurance, it's going to go higher for an older person. So somebody who's 20 years old is going to get a better
Right.
rate than, somebody
Right.
who's maybe 60. And when you go on to like an individual, like what is on the screen, it lists all the different plans that are there, that are available. What are the things that you can click on, on the screen to find out more about that particular plan? Like, are there, when people want to find out if their doctor
Right.
is covered?
On the actual website, when you go to the actual plans and prices, they have the plan benefits and the provider network is also listed there to look from. You can look up doctors. You can see what each plan entails. If you decide to go with that plan, there are many options on there where you can further go in detail as to what each plan actually offers.
And how about if they have prescription drugs?
Yes.
Does that also list
Yes.
that?
List everything.
What about dental or vision? Are those part of the plans, or can you describe how people can get that?
From everything I've seen, there's only one plan that will offer vision. Most of the plans do not offer vision and dental as a part of the plan, but they are offered as a separate plan if someone chooses to enroll in dental and vision. And the premium seems to be very reasonable on the dental and the vision plans.
Okay. Well, again, we're going to talk maybe a little bit more about this. At this point, I did want to also mention, and not to leave Maureen Zamorelli out, but Maureen is brand new to Access Health, and she's actually working with people who don't have insurance. And so there are going to be some people that unfortunately still slip through the cracks, and we're going to try to help them out. And that's what Access Health has been doing for about 3 years. Maureen, you're care coordinator, right? And would you describe, what the financial conditions are for who can, help you can work with, basically?
Okay. Sure, and thank you for having me today on Senior Focus, and I'm happy to be here. Actually, if individuals do not qualify for Medicaid or Medicare, they can call our office at 330-373-0703, and I will set up an appointment as well as speak with them on the phone, providing that they reach 2% of the poverty level or lower.
200%?
Or 200%, right.
That's okay.
200% or lower. And for a size of family unit, which would be of one, that amount would be $23,340. And I won't go through them all, but if it's a family of two, that number is $31,460.
So that's who we can help as a...
Right,
yeah.
that we can also help. And what we'll do then is we will connect these people with agencies and providers who can give them some assistance with dental and with other medical needs that they may have. For example, we do have the Chauvin Dental Clinic, and in Trumbull County, there's the Hands of Hope Clinic, which is exciting because we're really able to help a lot of people out who otherwise would not be able to get their medical needs met, and the Midlothian Free Clinic in Mahoning County.
Yeah, and we haven't had Midlothian Free Clinic on the show, but just so people know, they do great work. Dr. Albany started that over 5 years ago, maybe close to 10 years ago, and they now have moved, even though they're called the Midlothian Free Clinic. That was because they were originally at Bethel Lutheran Church on the south side of Youngstown. Unfortunately, the church is just closed this past December. They're going to be now at the, I think it's the First Presbyterian Church on Wick Avenue. So if you're familiar with downtown, as soon as you go up Wick, out of downtown, it's right on the right-hand side, just above the second federal courthouse, if you know the new, the federal courthouse.
Daniel Jones.
Yeah, and it's near the library, not too far from the Youngstown Library. So that's a Midlothian Free Clinic. And again, Maureen, you'll conduct an interview with folks. And there are a lot of needs out there. I mean, people need also like vision care.
Yes, vision, dental, pretty much I am really reaching out to try to meet the needs of individuals who otherwise cannot get it, no matter what it may be. So if there is someone who does not qualify for Medicaid or chooses not right now to go into the marketplace, then they need to call me at the 373-0703 number, and we'll get you connected and all set up with someone who can help you with any of your medical needs.
Yeah, one of the providers, obviously, in the area is Mercy Health Systems. They used to be Humility of Mary, and they're great to work with us. I mean, they're very supportive. Again, they have their dental van, which goes around the community and has come out to our office. They have prescription drug assistance. That's another thing that people should be aware of. If you're having trouble, financing your medications, they have an office, at St. E's.
At St. E's.
And St. Joe's up
St. Joe's
north.
Clinic.
Right, both. So, again, we're trying to let people know that if you are uninsured, there are options out there. And again, going back to, the timing now, we have February 15th, which is the enrollment deadline for the marketplace. And as I think Charlene mentioned, if you're Medicaid eligible, there's no worries. You can sign up in March or April, any time of the year. But if you're above Medicaid, and again, that's somebody, if you're by yourself, if you're above $16,100 some dollars, if that's your income and you have no insurance, the marketplace is what you want to look at. And you want to do that before the 15th. Now, there are some...
I was going to say, just to reiterate, there is no extension this year. The deadline is February 15th. Last year, they extended it out a little ways, after the deadline, but this year you have to be signed up by February 15th because there were some talks that there may be an extension this year. There is no extension this year.
And also, I would just like to say something about the penalty.
Yes.
If you did not have health care coverage during 2014, the penalty for adults is $95. It's half of that for a child that is age 18 or under, or 1% of your household income. So it's very important for people to understand that penalty, it will be going up every year. Like for next year, it's going to go up to $325 for adults, half of that for children under 18, or 2% of the household income. And then in 2016, it's going to escalate to $695 per adult, or half of that for children under 18, or 2.5% of the household income. But anyone whose income is below $11,700, they do not have to file a federal income tax return.
And so they would be exempt from
They would be exempt from the penalty.
Any penalty. But we have, and Elena and I were talking about this yesterday in our office, that we had a particular person who actually would have benefited by going on to the marketplace because the cost of the insurance with the premium tax credit would have been less than the penalty. So you would have gotten coverage and you would have paid less. So, we pretty much run out of time, and it went pretty fast. But I want to thank, again, from my right is Maureen Zamorelli and Elena Birch and Charlene Allen. We are all with Access Health Mahoning Valley. Again, if you have any questions, you can call us at our 330-373-0703 number. And again, don't forget, February 15th is the deadline for enrolling for health insurance in the marketplace. Until next time, I want to thank first, before we go, Greg Roten from Channel 20 and 100 with Armstrong, and Keith Kaiser from Mill Creek Metro Parks. But most of all, I want to thank you for watching, and we'll see you next time.